All right, let's talk about patient ratios really quick in rehabilitation nursing specialty. I had a question on a video about what's the patient ratios like, and I'll tell you, you are gonna see 1 to 5, 1 to 6 days and night shift. You're lucky if you'll see 1 to 4 on day shift, but it's like you'll get an admission and a discharge. Night shift, definitely maxing out at like 7. Some places I've seen 8. They usually have 1 to 8. I've seen that also on day shift, but it depends on the acuity. So I work at an inpatient rehab in a hospital, so the acuity is a little bit higher. So we're not going to have 8 patients. We are going to have 5 is doable and handleable on both shifts, really. But day shifts is busier. You might see 3 if you have a really tough patient that needs a lot of care, like a spinal cord injury, because you're doing everything for them. So if they have a bowel program in the morning, you have to get them up, get them to the bathroom, their bladder program, they need to be help fed. So plus medicine, maybe they have a G tube, you know what I mean, IV antibiotics, like this is what we do. So you might see 3 patients if you have a really difficult patient on days, not ever on night shift. So that's usually what the patient ratios are looking like right now. And again, I'm in Florida. I haven't worked in any other state. I think med surg is about the same, like 1 to 7, 1 to 8, 1 to 9, 1 to 10 maybe in the hospital. I don't know about 10. So I think we're right in line with like a doable assignment and patient load. So yeah, basically patient ratios, you're gonna see about 1 to 5 or 6. I'm like 1 to 6, 1 to 7 max. And I'm like and yeah, and I would also suggest, like, you know, doing some research about the hospital, because there's a lot of rehab units in the hospital now because it's just a moneymaker. So how did I do that again? I'm trying to get these buttons in the back, but I thought I'd put the seam like in the right place. Obviously not. Anyway, so you're gonna make more money in the hospital because there's shift diffs and you know, I think that like I was saying before, the acuity is a little bit higher, so you're gonna get paid better. But then you also see out like independent rehab facilities, and that's where I've seen the 1 to 8 patient ratio, because the acuity is a little bit less. You know, they still send the patients out if they get really sick. You know, you don't do a lot right there because you don't have everything right there. You have some stuff, but you still have to get lab in or x-ray or whatever. So in the hospital, we have all that right there. So we kind of keep patients, I think, longer because of that. So yeah, I hope you guys have a good day. I'm headed into work. And that's all she wrote. It's hot. It's a hot one.